The shape of the knee is super irregular and jagged and contoured. For this reason, it can be a little difficult to cup the knee. But all the tendons and fascia and soft tissues that attach here and help support the knee can take a beating, so it's super important to select the right cup and technique for the job. Because massage therapists and manual therapists from all different disciplines take this class, I'm going to include a technique that involves joint mobilizations and cupping together. So be mindful of your scope of practice, what is and what is not allowed, so that you can remain safe and remain within your clinical boundaries. So the first technique that includes joint mobilizations will have the client in the supine position with both legs relaxed and flat on the table. No bolster because we don't want the patella to be engaged or locked to any degree. We want it relaxed and in its patella groove. When you mobilize the patella, you want to make sure you don't compress it or smush it down, which will cause more damage and pain. Instead, you are going to just very, very lightly and without any downward force, slide the patella where you want it to go. Most times the patella is over laterally and needs to be mobilized medially. So I am going to move that patella now from the lateral position to the medial position. Once I get it in the medial position, again, there's no downward force. We're just going to press a little bit light coming toward me. I'm trying to bring the patella toward me. So we are going to mobilize that patella medially and pin it there with one hand while we take an edge cup, place it on the body, and then drive the cup around the exposed area. So if the patella was on the lateral side and we moved it medially, we've now exposed some of the lateral knee joint, and that's where we're going to cup. I have her patella mobilized medially, and I'm not pressing down. I put the cup on the lateral side of the knee, and now I'm going to take that cup and I'm just going to drive it around in the areas that the patella was previously covering. There are adhesions and all sorts of tissue issues in that area, so I'm just going to focus in that small, tiny area. If the cup breaks suction, I'm going to put it right back on and continue driving that cup around while I maintain that kneecap moving toward me. Then we are just going to rinse and repeat. We are going to mobilize and pin that patella laterally, then drive the cup around the medial side now that it's exposed. Mobilize the patella superiorly, pin and cup inferiorly. Mobilize the patella inferiorly, and then pin and cup superiorly. We're going to rinse and repeat. That way we get all angles of that joint covered. We get a little bit of patella mobility while still addressing those adhesions. Another way to address patella tendonitis is simply to dynamically cup around the entire patella, this time just without the mobilization of the patella. Because this area has a lot of bumps and turns and curves, one of the easiest ways to dynamically cup this area is to first place a bolster under the knee or even your knee. I'm not going to do that, but I can bring her into a slight flexion and then slide my knee under and rest her leg on top of my knee. But once she's here in that slightly flexed position, I'm going to take the cup and I'm going to drive the cup around. So I'm basically going to circle the entire patella. Again, this area is highly contoured, and so the suction may break. If the suction breaks, put that cup right back on and finish going around the patella. I like to use doorknobbing. You can break suction, move that cup wherever you want it to be, and then continue on with mobilizing that small edge cup. It's very important to make sure you get the distal quad as it inserts into the patella. A ton of adhesions hang out here. I actually like to play with the degrees of knee flexion, so I may have her all the way extended. I may have her, again, resting on my knee. I maybe even put her in a higher degree of flexion, and then I'm going to do the same thing. I'm either going to use a pinch grip method or even a donut technique to get the cup on, but I'm just going to drive that cup all around the knee. This way you get the engagement of different fibers, deep and superficial around the patella involved and addressed. Adhesions and tissue damage can limit the mobility of the quad muscle, which in turn can limit patella mobility. So another way I like to treat patella tendonitis is to place the client in the sideline position with the leg to be treated on top. Next, we are going to place size 2, maybe even size 3 edge cups on the distal end of the quad. We'll get one more for good measure. If you found adhesions and tightness in the rest of the quad, you could also place cups there, like in the mid or superior quad as well. Then we are going to stretch the quad from this position. I like to use a hold just above the ankle and stand behind the client while I do the stretch. So I'm going to bring her hip into kind of a neutral position, and then I'm going to bend her knee. With this technique, we are going to get some elongation of the quad muscle. We are creating movement at the patella, and we are decompressing, lifting, stretching, and mobilizing tissue around that quad. I'll hold my stretch for about 15-20 seconds, bring her back into a resting position just to take some stress off of those tissues, and then I'll go right back into that same stretch. My hold just above the ankle. The hip is in neutral, and we're going to just flex that knee while we keep those cups on. Beautiful stretch of the quad. We could add some muscle energy technique from here, having her try to extend her knee and resist it, and then take her further up into flexion. Let's try a little bit of that. I'm going to have you try to extend that way with about 20% of your strength. Good. And she is going into extension right now. I'm resisting that, and then I'm going to tell her to relax. She's going to relax. I'm going to give it about a 2-second kind of delay, and then I'm going to take that knee into more flexion. We're going to do that again. Try to extend your knee for me at about 30%, 20% of your strength, and then relax. 2-second wait, and then we're going to bend that knee even more, which we almost have her heel to her back pocket muscles, which is exactly what we want. That means we're getting some good stretching right there at the quad muscle, along with that stretching, lifting, and creating space right above the patella and the tissues in that area. Give that a try. Try it on the other leg too.